So what are some of the headlines we're looking at now?
Absolutely, yeah. So the feds, this is from Sudbury.com, are committing another $2 billion to provinces to address health backlogs, and that's caused by COVID-19. So this has been a subject we've talked about before. Because of the pandemic, because people, for many reasons, couldn't physically be diagnosed with chronic illnesses, cancers, screenings, a lot of things got pushed back. So the federal government is actually committing another $2 billion to help provincial health systems work through those surgical and diagnostic backlogs.
Yeah, and we talked about that was one of the side effects of how we managed the pandemic with calling off a lot of, surgeries and medical treatments. And so that, I think, is what this is for. They're
exactly
putting in how much money was that again?
So $2 billion to provinces. This is what surprised me most in the article. It says, the report, which came out last month, the Ontario Medical Association estimated that the pandemic delayed 21 million patient services. And that's just in Ontario. So that would be surgeries, preventative surgeries, cancer screenings, and diagnostic tests.
Wow.
And even before the pandemic, waiting times, there were many procedures that you would need to be put on a list for, and this has just exacerbated that. So this money is to get us back on track, especially those chronic diseases like preventative surgeries and things. They really need to get done in a timely manner, and hopefully we can catch up on that, despite the shortages that we have up here in the north, especially among specialists.
For sure, yeah. We've already had a hard time getting doctors in the north, just GPs, let alone getting in to see specialists. And so I know a lot of people have been impacted by the pandemic, and just people who already had been in the queue, let's say, to get treatment for whatever it is. And I know a lot of people have suffered. So hopefully we can get this thing booted up really quickly.